Thank you very much. I'm going to read a paper and hopefully have some dialogue. This paper is focused on a narrative approach, to a narrative family therapy approach to pain and suffering. So I'm going to talk about pain and suffering in terms of narrative, and then how we can use narrative language to work with pain and suffering. I just noticed that my printer left me without a page, so I might have to do a little improvisation here, but we'll flow it all together and then have something hopefully good to talk about. Pain, suffering, and family systems, a narrative family approach. Narrative family therapy as a collaborative psychotherapeutic process focuses on lived narratives and the revision of those narratives over the course of a lifetime. One need not consider long the ways in which people talk about themselves and about others before one notices the truth of the idea that people live in stories. Either to themselves or to others, people go about life narrating. They narrate a plot line that links together people and experiences over time and space by means of preferred and privileged understandings regarding how life should unfold. And often, the narratives in which personal identity emerges center on the ways in which those shoulds of how things should happen, of personal expectation, either come to be or fail to materialize. In other words, personal and family narratives tell of expectations met, disappointed expectations, and or expectations revised over time and experience. Easily enough, personal and family narratives become problem-saturated amidst the traumas of everyday life, and then the tragedies that often seem to strike like lightning from a blue sky without even thunder for warning. That's kind of the introduction. That's what I'm hoping to talk about over the next about 15 minutes. Now talking about the constitutive nature of narratives. The narratives by which people live and describe their expectations create meaning. Postmodern therapists that take postmodern social constructivism to a logical conclusion would go so far as to say that narratives create reality, a local reality pertinent to the one whose narrative receives voice at any given moment, and that these narrative realities represent the narrator's real world. Further, in that life consists of multi-storied expressions of lived experience, reality builds upon many locally active stories that make up a person's fluid identity. However, one need not take postmodern social constructivist philosophy to a logical extreme in order to appreciate the ways in which personal narratives made from the raw material of multi-storied experience of the world craft and assign meaning to those experiences. In short, just because one's personal story does not ontologically arrange ultimate reality, that is, much of what is truly real exists outside of and apart from my personal reality, just because that's true, this does not eliminate the fact that people craft and assign meaning within the context of narratives. The lived stories by which people make sense of their existential contact with what is real determine and express meanings that emerge from their experiences. This is very important in the world of psychotherapy and in spiritual direction and soul care of all kinds. If stories constitute meaning, and if meaning is disseminated through dominant discourses, then discourse, story, narrative can be the locus of personal transformation. Basically, change the story and you can change the life. The theory of change, both for persons and for social groupings, from families to nations, found in narrative approaches to healing and wellness, it focuses on a collaboration between therapist and client in the co-authoring of a revised narrative. Revised narratives lead to revised lives because the raw material of experience comes to be selectively arranged in new ways based on the awareness of new possible storylines that lead to new meanings, finding their way into the personal or family story. As abstract as this may sound, the feet on the ground effectiveness of this approach shows great promise. In other words, it just kind of works. Talking to people in terms of their personal stories, and you don't have to let people know that you're doing that. You can just simply talk to them in ways that elicit from them and that contribute to them ways of thinking in narrated storylines. It has a great effect on how people respond to their own experiences. So now I'd like to talk for a moment about the threat of thin, impoverished narratives. In the world of narrative therapy, you have thick and rich descriptions, which are to be encouraged, and sometimes people force that, which I think is a therapeutic aggressiveness to be avoided. I don't want to force somebody into a thick and rich description of their own experience. I would like to invite them to possibly have the opportunity to do that as they see fit. So there's a difference there between forcing that and letting it happen naturally. And the opposite of a thick and rich description is a thin and impoverished description of one's experience. Those who experience pain and suffering fight on two fronts. The first, and arguably the less important front, consists of the events and circumstances to which they ascribe the title, the problem, or problems. On the surface, these life experiences seem, to the outside observer, and often from the person observing from the inside of the situation, to be literally the problem. And from this vantage point, caregivers often feel quite as helpless as those who suffer because, well, the problem seems immutable. It simply is. The illness is there, the tragedy happened, the hurricane swept through, you don't have a house, whatever. The situation simply is, and it's not easy to envision changing the situation itself. Given that neither the sufferer nor the team of caregivers, whoever they may be, family or professionals, can guarantee that the situation will improve, it is easy for the pain-stricken and those who seek to support them might become immobilized by the circumstances at hand. However, the circumstances, as horrific as they may be, do not represent the most significant front in a person's battle with pain and suffering. Rather, the second front seems far more strenuous, namely, the battle for the narrative of pain and suffering. One could argue that the sufferer cannot affect the circumstances themselves, but that he or she can directly engage in that great struggle for defining narrative meaning in suffering. Here, both the sufferer and the support systems of those who the suffer, the support systems of those who suffer, so both the suffering person and the caregivers, family, and professionals, it's here they all can have direct and powerful impact on the situation at hand. Together, all these people can choose the story they tell to themselves and to others about pain and suffering. What does this mean? It's here. What is it going to mean for us? That's something they can directly impact in their experience. When a problem-saturated narrative becomes constitutive of a meaning-deprived story because of thin, impoverished descriptions, then the battle for meaning can be lost, which then serves to perpetuate not just pain and suffering, but meaningless and hopeless pain and suffering. What are these thin and impoverished descriptions, and how do they contribute to a flattened out narrative that inhibits the development of meaning in the face of suffering? Thin descriptions of a sufferer's experience first represent the descriptions imposed onto the suffering person's experience from the perspective of others. How easy this is to do. Oh, you poor thing. Oh, bless your heart. Oh, this is God's will. If we impose some kind of a meaning from the outside, simply because it does not come from the context of the person's own experience, that automatically represents to me and to many a thin description, because the person suffering isn't the one that owns it. When a suffering person's story gets taken over by others, it inherently becomes thin because the person in pain loses his or her voice and the story of suffering becomes co-opted. The story told by others of a person's pain and suffering cannot adequately express what the sufferer experiences. It's hard enough simply to understand it from the outside. I can never fully sit in somebody else's situation. It's difficult enough just to understand it. To take on the role of describing it, of giving it meaning on behalf of the other, that comes darn near the hermeneutic violence that we were talking about just the last hour. So thin descriptions come from outside the perspective of the sufferer and constrict the personal story of the person in pain. And when the power of definition is arrested from the person who is suffering, thinned out conclusions about that person's experience are automatic. When we just assume the right to define their experience and to tell their story, we thin it. We thin it out and we impoverish it because it's not coming from the person's context. Maybe you've experienced this in hospital rooms, as I have, or in many different contexts, where you walk in to make a visit and the person in the bed doesn't get allowed to speak. They're capable, but they are not afforded the opportunity because somebody else starts telling the story. And often, I find myself listening out of this ear to the person talking and looking at the person in the bed, and the story I'm hearing and the look I'm seeing, they're not congruent. And I realize somebody else is telling this person's story. And it can be tough. It can be very difficult to open the space for that person to speak. How difficult. I've actually had to ask people to leave. Can I please have a few moments with Jeff, with Fred, with Mindy? Can I have a few moments by myself with them? Would that be okay? So it's hard to get to the real story when everybody else around the room is telling it, and of course then you have those family feuds where grandma doesn't agree with so and so and Uncle Bob, and now you can watch the narratives get into a fight right over top of the bed of the person who's laying there suffering. These are things you've experienced in chaplaincies and various other experiences. So when the story gets taken from the person, automatically it becomes thin and impoverished because the person who needs to tell the story is not given the opportunity to do so. The second characteristic of a thin description, and this is where my notes get a little bit sketchy, but I can kind of talk this, is when the narrative, no matter who's telling it, when the narrative becomes saturated by the problem, when it becomes what narrative therapists call problem saturated, then we're dealing with thin and impoverished descriptions. They're usually one-dimensional, and they're almost always focused on failure, negative interpretations, dysfunction, weakness, inability, and those kinds of themes. When they're all woven together in the story, and that becomes the focus, the story is usually told very quickly. I can't do except this, that, or the other, or whatever. It's very negative and very disability focused, and that represents an impoverished or a thin narrative because it's not taking into account greater portions of the experience. It's just simply locked in on that one dimension and that one aspect. Again, narrative therapists in family therapy will often work to push, if you will, to gently shove a family toward a more thick and rich description by asking certain kinds of questions that purposefully evoke certain kinds of information that then create exceptions to the thin narrative. Well, have there been times when this wasn't the case? Have there been times when you've been stronger? Have there been times when, and these questions are to evoke other dimensions to the story. And that's been proven to be very helpful in narrative therapy and in solution-focused family therapy. I consider it a little bit aggressive. I don't like doing that. I want to wait, if I can, until the patient, the client, the family, until they are ready to talk about something else. And you have to be, it's very subtle. They're not going to say, great, we've talked about all that and now we're ready to shift. If they were that self-aware, they probably would have shifted on their own. So I'm listening to the story and waiting for moments of opportunity where they open the door to something different, where you can see the chance for a more thick and deep and multidimensional and complex description to develop. So thin descriptions come from something outside the person who's suffering from their experience, and they're usually focused entirely on negativity and all of the problem saturation of the story in which they see themselves. These problem-saturated stories, they are thin and impoverished because they fail to take into account much for which the sufferer or his or her support system might be grateful. But it's kind of rude to ask in the midst of somebody's suffering, well, don't you have something to be thankful for? And that's a rather aggressive shift of the discussion, and sometimes that's a therapeutic method, and sometimes it might be appropriate. It's not always, I don't think always appropriate to steer the storytelling. It seems more appropriate to sit with the story as long as you possibly can and see if they'll open that door and go down that road. Okay, so that's thin and impoverished descriptions. So these are a threat. What I lost was the threat to the person who's suffering. That's easy to talk about. When narratives become problem saturated, it keeps a person locked in their suffering, and it can create meaninglessness, as I said earlier. The whole narrative gets just steered toward problem saturation, then you find somebody locked in suffering, and what is threatening to them is the inability to see anything else other than that, and so that's a threat to the person who's suffering. To these thinned out expressions is that they just impoverish the story, and they can lead to meaningless and hopeless suffering. There's just nothing here but pain, suffering, and problem, and that's a threat to a person who is in a vulnerable position. I think this is especially true when somebody else is telling the story. We need this person to be weak because it gives us a purpose. That's when it becomes dangerous. I'm telling your story for you. I'm saturating it with your problem, and I'm not going to let you out of that because it's functional for me for you to be broken. This happens so often in caregiving, and so it's a threat to the person who's actually suffering, not to let them tell their own story, and then to continue to absorb into that a just one strain of narrative after another of pain, suffering, and impoverishment. The threat to the caregiver. This can be a threat to the caregiver as well. When those who would care for the suffering become overwhelmed by problem-saturated narratives, they slip into the emotional immobility that forecloses on any chance of becoming a healing presence to those who suffer. In what Father David Alexander calls dyadic epistemological reductivism, the sufferer and the caregiver become mutually complicit in the paralyzing experience of narrating a story that reduces the sufferer to the position of a victim, which again disempowers the sufferer. So if I, as a caregiver, walk into somebody's overwhelmingly negative situation and am immediately immobilized by that, then I might want to tell myself and the other person a story of negativity and impoverishment because I just don't see a way out of it. It helps me feel better as a caregiver that to tell your story in a negative way. It's just, this is impossible. It removes me from any kind of responsibility to be present to you. I don't have to really engage because, well, I'm well, you're sick, nothing's going to change. It sucks. It's terrible, and then we become immobilized entrapped in that narrative. This disempowers the sufferer, doesn't allow them, by means of our presence, to begin to maybe even consider stepping out of not the circumstances, but what meaning they're assigning to it. Oh, you poor thing. You know, those words can lock somebody in their suffering, and that's what we can accidentally fall into that as caregivers. So a dyadic epistemological reductivism means that the two of us get trapped in a cycle of negativity, caregiver and sufferer, and we just continue to walk around the same terrain over and over. And we do that because I don't believe, as the caregiver, there's anything else we can do together. I just don't see it. I don't believe it, and so I'm going to stay with that. So it disempowers the sufferer. Further, the caregiver might become trapped by this story into a polarization that sees the caregiver at one end of the spectrum and the sufferer at the other. The helper and the helpless, the well, the sick, the powerful and the powerless, and the like. The ontological space that such polarizations creates threatens the integrity of the relationship between the sufferer and the caregiver, and this threatens the efficacy of the relationship in both directions. The blessing that the caregiver brings to the sufferer, which can't be received, and the blessing that the sufferer holds out to the caregiver, both of these blessings can be lost in the space opened up between two people by polarized thinking that causes and is caused by thin descriptions of suffering and the impoverished narratives that these descriptions create. When a caregiver becomes trapped in an epistemological project dominated by problem-saturated narrating, the reduction of the sufferer and his or her experience to helpless victimhood can sap the caregiver of resource and motivation for compassion. Compassion fatigue soon sets in, and burnout awaits around the very next corner. The suffering person remains entrenched in the problem story to the point that the story becomes the problem as the narrative confines emotional movement into the context of the circumstances, not allowing a person to kind of get beyond that and see something bigger. The helping professional feels a magnetic pull toward empathy without initiative. And this leads the helper into a paralyzed pity for the suffering or an anxiety-induced avoidance of the sufferer's pain. In either case, caregiving is rendered ineffective and the caregiver contributes to the problem. In sum, descriptions of a person's suffering that come from outside the sufferer's experience and that remain focused solely on a relationship to the circumstances of suffering characterized by victimhood, helplessness, and failure represent thin descriptions that contribute to thin, impoverished narratives of suffering, which are entrenched in meaninglessness and hopelessness. Family members and caregivers often contribute to these one-dimensional stories by disallowing the sufferer the agency to craft his or her own story. When family systems and caregivers, out of their own grief, anger, mourning, or emotional responses to a loved one's pain, impose upon the sufferer a problem-ensconced narrative laden with helplessness and victimization, the entire system comprised of the sufferer, family and friends, and caregivers becomes locked into an immobilizing, problem-compounding experience of pain that degenerates into meaninglessness. So I have to kind of wrap up, but I go on to talk a little bit about the remedy to this, but I think it's apparent. It's kind of self-evident, the remedy to this, which is a great deal of self-awareness, and we need neither to shove people out of their one-dimensional thin descriptions. We don't have to push them out of that, nor do we have to just leave them there. I think one of the remedies is just to be self-aware and to listen to the story. Let the person who's suffering tell the story. When I'm working with family systems of somebody suffering, I encourage the family, please, let Uncle Bill tell his story. I know that you're struggling with this, but it helps him to be, to be able to say things. And you hear it all the time. Somebody in the hospital bed, I really feel like this is it, like it's over. And somebody always says, "Oh, don't talk like that. Oh, 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 don't say that." Why? I don't want to hear it. But the person who is experiencing it needs to be able to. And so when I hear that kind of shutting down of someone's story, I encourage them, please let him. I know it's hard to hear. I know it's hard to hear, but you have to let the person tell. Let's participate in his story or her story. Let's all just listen and take this in. We can do far better by just listening to it than by trying to address it. And none of us, none of us have the resources to make a change happen. So can we just inhabit this person's story? If we do that, I promise you, they will open up to something deeper. They'll allow the space to open for at least a little bit of a thicker and more rich description of their circumstance, if we let them really be with what they're experiencing. And so the story will change. We don't have to make it change. It'll change on its own as we attend to what we're hearing. So that's the kind of the remedy to the deal.
We have a couple minutes for questions. Feel free.
What would you say happens when the caretaker becomes a sufferer?
When the caregiver becomes the sufferer.
Right.
Well, I think it's possible for that to happen without it falling into this kind of dyadic reductivism that I was talking about. I think. Are you talking in terms of as we're hearing the sufferer's story, we too suffer with them, we co-suffer?
Well, that would be one way. But what on the other hand, what I was really thinking is, what if you, for example, God forbid, were the sufferer? Could you use this for your own sake?
I certainly hope so. I'd like to think so. This is great. My dad's sayings that I took with I had a kidney stone one time, and I was telling him about it, and he said, at the end of our conversation, I'm about to hang up, and he said, just remember, just because you're in pain doesn't mean you have to be one. And he was thinking about my wife and my children, because I was really hurting, and it could be angering and frustrating. And so I hope that I could say, let's develop this story. What's deeper here, and keep it more full, rich, and deep, so that it isn't impoverished and it doesn't inflict, suffering on others. I hope that I'd be able to be able to tell my own story in those kind of terms, meaningful suffering rather than meaningless victimhood. I hope so. Yeah. I'm not saying that would be easy, but yeah.
I'm just wondering if you've noticed any kind of cycle that sufferers have when they tell their story. Are there signs when you see them sort of hitting the bottom and beginning to come up the top? Is there, does that happen?
Yeah. She was talking about a cycle where at some point the conversation will shift. I don't know if I could prescribe it in steps, but it is something that you can feel. Sometimes I miss it, I'm sure, but the idea, literally one person said to me one time, enough of that. And I was like, so what does that mean for you? It's like, I want to talk about something else. There's got to be more here than just, kind of like I'm done describing my pain. Thank you for listening to all of that. There's got to be something more we can talk about. And that's when I begin to ask a different set of questions. What more is there in this for you than just what we just got done talking about? And so I think you can kind of, sometimes it's way more subtle than that, and it might not happen all in one visit. It might not happen all in one visit. And that goes back to your question earlier. If people keep calling me back to keep talking about this, am I really achieving my goal? Am I getting to the outcome? And people sometimes need to extendedly talk about their suffering, and that's okay. as long as I don't get trapped in it and think, well, oh, poor person, I'm always thinking to myself, when is this going to shift for them? Where is the strength? Is it there? You know, and how do I find it? I'm not trapping them in their suffering in pity. I don't want to be, people don't want us to pity them. I think they want us to hear and listen and appreciate. And I think in doing that, a lot of times that's where the moments come where they're ready to talk about something else, ready to shift and tell a different story, or a more rich version of their story. Yeah.
Thank you again, Father.
Thank you.